When NASA astronauts Scott Kelly and Sonny Williams safely splashed down in the waters off the coast of Florida, marking the conclusion of their 9-month space mission, they not only completed an experimental spaceflight, but also became vivid examples of the profound challenges the human body faces when venturing into space. This event underscored a crucial phase in understanding the long-term effects of a zero-gravity environment on human health. This article explores the health of astronauts post-return, the physiological and psychological transformations they undergo, and the global scientific research dedicated to unraveling the recovery process. One, the rigors of space travel. Earth provides a constant gravitational force to which our bodies are meticulously adapted. In the vacuum of space, however, astronauts encounter a microgravity environment, inducing significant and often startling physiological alterations. These changes profoundly affect the musculoskeletal, cardiovascular, and neurological systems. Muscle and bone atrophy. One of the most consequential issues astronauts face is the progressive loss of muscle and bone mass. NASA studies indicate that astronauts can lose up to 1/3 of their muscle mass within 2 weeks of spaceflight. Furthermore, bone mineral density can decline by as much as 1% to 1.5% per month. This rapid bone deterioration elevates the risk of osteoporosis and fractures upon returning to Earth. Research from the European Space Agency, ESA, corroborates these findings, revealing that bone mineral loss in space can mirror the bone loss experienced by postmenopausal women on Earth, a grave concern for extended space missions. Russian studies conducted on the Mir space station documented bone loss rates of up to 2% per month during prolonged stays. This phenomenon is primarily attributed to the unloading of skeletal structures and muscles. Without the constant pull of Earth's gravity, the body no longer needs to exert the same force, leading to muscle and bone weakening. This process is also influenced by the disruption of normal bone remodeling, where the balance between bone formation and resorption is altered in microgravity. Additionally, changes in hormonal regulation and reduced vitamin D production due to limited sunlight exposure contribute to bone loss. Alterations in body dimensions. A curious effect of spaceflight is the increase in astronauts' height. In the absence of gravitational compression, the intervertebral discs of the spine expand, leading to a temporary increase in stature by several centimeters. This height increase can range from 3% to 5% of their earthbound height, dependent on mission duration. This elongation is not permanent. Upon return to Earth, gravity reasserts its force, and the spine compresses back to its normal state. However, the temporary increase can cause discomfort and back pain for some astronauts. Cardiovascular and circulatory strain. The circulatory system undergoes significant stress in space. Without gravity to facilitate blood flow from the lower extremities back to the heart, blood accumulates in the upper body, causing facial puffiness and congestion. This redistribution of fluids can lead to cardiovascular complications and fluctuations in blood pressure. NASA and ESA research has shown that this fluid shift can result in a 10% to 15% reduction in plasma volume, impacting the heart's ability to pump blood efficiently. This plasma volume reduction can lead to dehydration and electrolyte imbalances, further complicating cardiovascular adaptation. Post-flight, astronauts may experience orthostatic intolerance, marked by dizziness and lightheadedness when standing. Cardiac arrhythmias have also been documented. These arrhythmias are often linked to changes in autonomic nervous system function and electrolyte imbalances. Long-term research is still being done to understand the full long-term effects on the heart. Ocular changes. Visual impairment is another significant health concern for astronauts. NASA reports that approximately 40% of astronauts experience visual changes upon returning to Earth. These changes are largely attributed to the cephalad fluid shift, which increases intracranial pressure and affects the optic nerves. The spaceflight-associated neuroocular syndrome, SANS, is a condition of particular concern, marked by optic disc edema, globe flattening, and changes to the refractive error of the eye. SANS can lead to long-term vision changes for astronauts. Magnetic resonance imaging, MRI studies have revealed structural changes in the eyes of astronauts, including flattening of the eyeballs and alterations in the optic nerve. These MRI studies have also shown changes in the cerebrospinal fluid, surrounding the optic nerves, further indicating the impact of intracranial pressure. 2. The post-flight recovery process. Upon returning to Earth, astronauts embark on a protracted and demanding recovery process. Although most physiological changes gradually improve, the recovery timeline can range from weeks to months, with some effects, particularly bone loss, requiring a year or more for complete resolution. Restoration of muscle and bone integrity. As previously mentioned, muscle and bone atrophy is a major concern. However, the body initiates a recovery process upon returning to Earth. Muscle and bone mass gradually return, but this process is slow and requires targeted interventions. Rehabilitation exercises are critical for recovery. NASA studies emphasize the necessity of specific exercises, including treadmill running, cycling, and resistance training, to stimulate muscle and bone regrowth. However, complete recovery can take a year or more, especially for those who experience significant bone loss. These rehabilitation programs are often tailored to each astronaut's specific needs, incorporating individualized exercise plans and nutritional guidance. ESA and Russian Space Agency, Roscosmos, rehabilitation programs also stress the importance of weight-bearing exercises and nutritional supplementation to support bone and muscle recovery. They also include the use of vibration therapy, which has shown promise in stimulating bone formation. Cardiovascular and circulatory readjustment. The adjustment of the cardiovascular and circulatory systems requires a substantial period. Astronauts must gradually adapt to Earth's gravity and recalibrate their internal organs. During this phase, they may experience symptoms such as dizziness, fatigue, and shortness of breath. Research from NASA's Johnson Space Center indicates that cardiovascular stabilization can take 2 to 3 months. This stabilization involves a gradual return to normal blood volume distribution and heart function. Recovery protocols include hydration, gradual physical activity, and continuous blood pressure monitoring. These protocols also incorporate the use of compression garments to aid in venous return and minimize orthostatic intolerance. Visual acuity recovery. Visual disturbances can take an extended period to resolve. In some cases, astronauts may require medical intervention. However, most astronauts experience a gradual return to baseline vision. Studies suggest that visual recovery can span from weeks to months. This recovery involves the gradual normalization of intracranial pressure and the resolution of optic nerve edema. Researchers are exploring countermeasures such as lower body negative pressure, LBNP devices, to mitigate the effects of SANS. These devices help to redistribute fluid from the head to the lower extremities, reducing intracranial pressure. 3. Psychological and emotional sequelae. In addition to physical changes, astronauts experience profound psychological impacts upon returning from space. The experience of viewing Earth from space can fundamentally alter their perception of life and the world. Profound connection to Earth. Many astronauts describe a heightened sense of connection to Earth after spaceflight. The experience of seeing the planet from afar often instills a deep appreciation for its fragility and beauty. This phenomenon, known as the overview effect, can lead to a profound sense of responsibility for environmental stewardship. Shift in perspective. Astronauts frequently report a transformation in their worldview. The overview effect, as it's known, often leads to a more philosophical outlook on life and a heightened awareness of interconnectedness. This shift in perspective can influence their personal relationships and their approach to problem solving. Anxiety and readjustment. The transition from the unique and highly controlled environment of space back to everyday life can be challenging. Some astronauts experience anxiety, depression, and difficulty reintegrating into society. The shift from a highly structured, mission-oriented environment to the less predictable rhythms of life on Earth can be disorienting. Studies have shown that some astronauts experience problems with sleep patterns and also problems with social interactions after returning to Earth. These difficulties can be exacerbated by the feeling of isolation, as their experiences in space are often difficult for others to fully comprehend. 4. International research and key findings. Extensive research has been conducted to elucidate the effects of spaceflight on human health. Notable studies include NASA's twin study, which compared identical twins Scott and Mark Kelly, one of whom spent nearly a year on the International Space Station, ISS. The twin study. This landmark study provided unprecedented insights into the genetic, physiological, and cognitive effects of long-duration spaceflight. Results revealed changes in gene expression, telomere length, and cognitive performance. This study provided valuable data on the effects of spaceflight at the molecular level. The study showed that telomeres, which are the ends of chromosomes that shorten as people age, actually lengthened in space, but then shortened quickly once back on Earth. This surprising result highlighted the complexity of biological adaptation to spaceflight. International collaboration, ESA, Roscosmos, and other space agencies have contributed significantly to our understanding of space-related health issues through research conducted on the ISS and other platforms. This collaboration has fostered the sharing of data and expertise, accelerating the pace of scientific discovery. In summary, while space travel continues to push the boundaries of human endurance, ongoing research and the collaborative efforts of international space agencies are paving the way for safer and more sustainable space exploration. The insights gained from studies on astronaut health not only benefit those who venture into space, but also contribute to our understanding of human physiology on Earth. The journey to unravel the mysteries of space adaptation and recovery is a testament to the power of human ingenuity and international collaboration, a journey that will ultimately shape the future of space exploration and human health.